Tonight, the state is reporting a downward trend in COVID-19 cases, about 2,000 in the past 24 hours. We're also seeing fewer deaths and hospitalizations. As far as vaccinations, 2.6% of Ohio is fully vaccinated.
Still, CDC figures show Ohio still lags behind dozens of other states with these shots.
Tonight, Chief Investigative Reporter Bennett Haberly asking the governor what the state could do to improve this.
Ohio's coronavirus vaccine rollout has been a patchwork of positives and problems. Healthcare workers, seniors, and now teachers have been among the first groups vaccinated.
First time in my life I was ever excited to get a shot.
Emily Miller told me she got her first dose a few weeks ago.
It's a pretty crappy year. It's with a lot of people. So I've had some health problems, and that's the reason why I particularly wanted to get it. And I want to have a life again.
A similar story from June Allen, who got her vaccine at a local hospital.
So this is a good day, a real good day.
But not every story has been as rosy. A do not waste list initially caused a stir when it was revealed the Columbus Public Health Department initially didn't place any age or health restrictions on who got on that list.
There was a period of time that we did open it up to the public and did not put any criteria to that. It was up on our website for about...
Was that a mistake?
That was a misstep on our part. Yes, it was.
We've also seen vaccine wasted. Provider Specialty RX lost its state contract after mishandling nearly 900 doses. Others say the vaccine has been hard to find.
And when you go to the website, you get that there's no openings, that the vaccine registration is currently closed, and it's just a cycle.
Maria Griffin, a 7-year-old caregiver, told us the day after our conversation that she and the adult with developmental disabilities she cares for were able to get the vaccine, but only after canceled appointments and bureaucratic headaches.
And I understand the frustration.
Governor Mike DeWine acknowledged that there is far more demand than supply, but said he is encouraged that the supply chain could soon increase. Still, Ohio trails dozens of other states.
When it comes to putting shots in arms, why are we failing?
Yeah, first of all, that data is really not right. Let me start with basically congregate care settings, assisted living, nursing homes. We're fifth in the nation in getting shots in arms of people who are the most vulnerable people.
The governor's office later called 10 Investigates to dispute that Ohio is failing. Their contention, Ohio is where it needs to be. CDC data ranks Ohio 5th when it comes to vaccinating those in long-term care facilities. The state's own data shows people age 70 and up account for 78% of all deaths in Ohio from COVID. But when looking at the standardized rates of doses administered per 100,000, CDC data shows Ohio trails 38 other states and U.S. territories when it comes to putting shots in arms. The governor's office disputes this number, claiming most states are statistically bunched together, and those appearing to outperform Ohio have fewer nursing homes and smaller populations.
If you look at the data, we're doing okay, we're doing well. We're focusing on the most population that is the most vulnerable population. And I will not back up from doing that.
Let's take a closer look at how the vaccine comes into Ohio. Each week, the Ohio Department of Health says the state gets roughly 168,000 doses. They're then distributed to 2,900 providers, places like hospitals, big-name pharmacies, and grocery stores. Right now, though, not all providers are getting those doses. Each week, it varies.
If you had to give yourself a grade for how we've done with the vaccine rollout, what would you give yourself?
Look, I don't grade ourselves. People will grade me. They grade me every day, and I understand that, and that's fair. I'm the elected official. I'm the guy at the top, and the buck stops with me. We're trying to put vaccine out in every neighborhood, and we're trying to make it so that people who are underserved, people maybe who don't have access to the medical care that other people have, we're doing everything we can to make sure they get it.
Bennett Haberly, 10 Investigates.
All right, so what's next? The governor said he is encouraged by news the vaccine supply chain could increase. The state does plan to pause adding any eligible age groups after 65 and up for the time being. Now, the state is also working on introducing an online portal in the coming weeks that will help streamline vaccine appointments.